Ali, the leader of opposition in the opposition team. I disagree with the motion. Today I'm going to explain my first main point, which is the quality of diagnosis will go down, and the second main point, which is small hospitals will be out of business. Then I'm going to review to the government's main points 1 and 2. But first, I'll explain my first main point. To diagnose, doctors need to see the patients. Also, they need to apply a stethoscope, which is needed to hear your heartbeat to the patient. Also, it is hard for doctors to know how exactly the patients are ill. If we pass telemedicine, there is a high possibility of wrong diagnosis. Therefore, there will be lots of side effects. For example, they can say that it's just a cold when it is pneumonia, which is the severe illness in your lungs, because the symptoms are similar. Now I will explain my second main point. My second main point is that small hospitals will be out of business. People prefer to go to university hospitals or big hospitals, but they can't go because they are far away from them. If we allow telemedicine, because they can do it in their homes, they will only call to the big or university hospitals. Patients in small hospitals will decrease. The doctor needs to buy new machines because patients prefer hospitals with the latest machines. If the doctors don't have profits, they can't buy the machines, then they can't get patients. Then they might lose their jobs, which increases unemployment rate and make the government to use more money on welfare system. Now I will refute to the government's main points. They said about efficiency, but the diagnosis is not trustworthy. POI, please. Okay.
Should I just say? Okay. In our Prime Minister's speech, we have stated the definition of telemedicine as like regular checkups or like checkups for patients who are not in critical condition. But however, like for patients not in critical conditions, it is kind of hard to make like not good diagnosis. How can doctors make a wrong diagnosis if the patient is not in a critical condition?
Doctors are people, and people always do. People sometimes do mistakes, but how cannot they do the wrong diagnosis? Now I'll go back to my refutation. And instead of telemedicine, it is better to make the doctors to visit them. They said that we can save the time to go to the hospitals, but instead of telemedicine, it is better to make the doctors to visit their homes. And second, they said the disabled or elderly will have the benefits of telemedicine, but some disabled or elderly don't know how to use telephones or TV, and others don't even have both of them. Now on to my second refutation. They said they can use the welfare system for citizens, but the other hospitals that that don't have money will fail because people go to the big and the university hospitals. Today I've been talking about why we should not allow telemedicine and for-profit medical subsidiaries. First, it is because we can make the quality of the diagnosis lower and the small hospitals will be out of business. Because of these reasons, please vote for us. Thank you.